Did you know that a single misplaced minute, just 60 seconds, can decide whether a senior walks again, speaks again, or even survives a stroke? It's a chilling reality most people never hear until it's too late. Every year in the United States, thousands of older adults experience the first quiet warnings of a stroke while sitting at the kitchen table, watching morning news, or reaching for a cup of coffee. A hand suddenly feels weak. Words come out tangled. The world tilts for just a moment. And because the symptoms seem small or brief, many seniors ignore them, hoping they will pass. But those early signs are not accidents. They are alarms from the brain, urgent, desperate, and time-sensitive. In those moments before the ambulance arrives, your actions can protect the brain from permanent damage. You don't need medical training. You don't need equipment. What you need is awareness, calm, and the right steps in the right order. This video will guide you through the 7 critical actions every senior must take in the first 3 minutes of a suspected stroke. Steps proven to save precious brain function and preserve independence. Stay with us, because knowing what to do in the very first moments could become the wisdom that saves your life or the life of someone you love. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoyed this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1, sit down immediately to prevent a fall. When the first strange sensation rises, an unexpected wobble in the legs, a heaviness settling in one arm, or a sudden wave of dizziness that makes the world feel tilted. Many older adults try to push through it. It is a habit built over a lifetime, staying strong, staying upright, refusing to give in to weakness. But in the early moments of a stroke, that instinct can be dangerous. The body is not betraying you, it is warning you. And the safest, wisest response in that moment is far simpler than most seniors realize. Sit down immediately. Sitting is not a sign of giving up. It is an act of protection. For older adults, a fall during a stroke is often more devastating than the stroke itself. A sudden drop in balance or strength can send someone to the ground with no way to brace the fall. Head injuries, hip fractures, spinal damage. These are complications that turn a medical emergency into a long, painful recovery. Many seniors never return to their previous level of independence after a stroke-related fall. That is why the first few seconds matter. The moment something feels off, the moment the body begins sending signals it has never sent before, the safest thing to do is lower yourself into a stable, seated position. Sitting also gives your brain a chance to compensate. When blood flow to the brain is disrupted even briefly, the brain struggles to keep the body coordinated. Judgment becomes cloudy, vision may blur, muscles may lose their strength without warning. Trying to walk, reach for something, or steady yourself only increases the risk of collapsing. But when you sit, you remove gravity as an opponent. You reduce the strain on your heart, ease the demand on your muscles, and give your brain time to signal for help in the only way it can through these subtle, sudden changes that no one expects. For many seniors, the idea of sitting down when something doesn't feel right may feel embarrassing or unnecessary, especially when symptoms appear mild or pass quickly, but mild symptoms are often the first whisper of a stroke. Medical research shows that transient weakness, brief dizziness, or momentary speech difficulty can be the earliest warning signs, appearing minutes or even hours before a more serious episode. Sitting protects you during these moments of uncertainty, giving you a safe position to observe what your body is trying to tell you. And sitting is only the beginning. Once seated, the mind grows clearer, the breath steadier. You can assess your surroundings. You can reach for your phone more safely. You can call for help without the fear of collapsing mid-conversation. In an emergency, clarity is power. Stability is safety. The single act sitting can prevent injury, preserve independence, and potentially save your life. But the truth is this: sitting down is only the first step. What you do in the moments after you sit can make an even greater difference, because the brain does not just need safety. It needs circulation, oxygen, and support. And that leads to the next essential action, one that most seniors have never heard of, yet may determine how well the brain survives those first critical minutes. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2, lie flat on your back. When a possible stroke begins, the body sends its warnings, not with loud alarms, but with small interruptions, an uneven breath, a drifting sense of balance, a strange heaviness tugging at your face or hand. In those early minutes, your brain is asking for help in the only language it has, slowing down, dimming, struggling to keep up. And while sitting keeps you from falling, lying flat on your back is the next essential act that protects the most delicate, most vulnerable organ you have, your brain. For older adults, blood flow to the brain is already more fragile than it once was. With age, arteries stiffen, the heart works harder, and circulation doesn't always stay steady when the body is under sudden stress. During the early stages of a stroke, blood may not reach parts of the brain the way it should. When you remain as upright, gravity pulls blood downward away from where it's most urgently needed. But when you lie flat, you remove that burden. You create a straight path for blood to reach the brain with less effort, less resistance, and less delay. Lying flat is not just a comfortable position, it is a medically recognized way to support cerebral perfusion when the brain's oxygen supply is threatened. Doctors who treat seniors know that even brief dips in blood flow can leave the brain struggling. And every minute matters. The moment you feel your speech slipping, your thoughts clouding, or your vision dimming, getting into a flat position gives your brain its best chance to hold on until help arrives. Many older adults hesitate to lie down because they associate lying flat with weakness, illness, or being a burden. But this simple act is one of the strongest, smartest choices you can make for yourself. It is not surrender. It is strategy. It is understanding that your brain cannot fight back if your body is working against it. When you lie flat, you allow your heart to pump more efficiently. You let the blood move upward without struggling against gravity, and you give your brain a chance to stabilize, even if only slightly during those uncertain moments. It is also important to acknowledge the emotional side of this moment. Lying flat can feel vulnerable. It can feel frightening, especially if you are alone. But vulnerability is not failure. It is a moment of truth where you choose to protect your future. You are giving yourself the best chance to maintain your ability to speak, walk, remember, and live independently. This is not weakness. This is wisdom. Medical studies involving seniors have shown that those who lie flat during early stroke symptoms often preserve more neurological function than those who remain upright or try to keep moving. The reason is simple. Your brain deprived of oxygen needs every advantage it can get. By lying flat, you stabilize what little blood flow remains. You slow the rate of damage. You turn minutes of confusion into moments of control. And as you settle into that position, your back supported, your head level, you may notice a shift inside yourself. Breathing becomes easier. The sense of rushing panic softens. You may feel more grounded, more aware. And this is exactly what your body needs. Steadiness, calm, a chance to hold itself together while the brain fights for equilibrium. But lying flat is not the final step. Once your body is in the safest position for blood flow, there is another powerful action you can take, one that uses your breath, your focus, and your inner composure to protect your brain in a way most seniors have never been taught. It is simple. It is natural, and yet its impact can be extraordinary. 3, elevate your legs about 12 in. Once you are lying flat, the body enters a vulnerable moment, a moment when the brain is quietly pleading for support, for oxygen, for anything that will help it survive the interruption in blood flow. For seniors whose circulation naturally slows with age and whose blood vessels may have stiffened over time, this moment carries even greater weight. That is why raising your legs even just about 12 in becomes far more than a simple adjustment in posture. It becomes a lifeline, a way to guide blood where it is needed most, back toward the heart and upward to the brain. As we age, our bodies change in ways we often do not notice day to day. We walk a little slower, our ankles may swell more easily, and our legs may feel heavier at the end of the afternoon. These are signs that circulation in the lower part of the body becomes less efficient with time. Blood tends to settle in the legs, especially when sitting for long periods or when veins lose their elasticity. In everyday life, this might simply feel like fatigue. But during the early minutes of a stroke, when the brain is being starved of blood, these natural age-related changes can make the situation more dangerous. Every drop of blood pulled in the legs is a drop not available to help the brain. By gently elevating your legs, you shift the balance of gravity. Blood that would normally remain in the lower limbs begins to move toward the chest, where the heart can pump it upward with greater force. This small rise 12 in about the height of a folded blanket or 2 pillows is enough to encourage a meaningful shift in circulation without causing strain. Neurologists describe this as augmenting venous return. But for seniors, it is simpler to understand. You are helping your heart do its job with less effort. You are giving your brain more of the oxygenated blood it needs to stay alive while help is on the way. The act of elevating the legs also reduces pressure on the vascular system. When the legs are raised, the veins no longer fight against gravity. This reduces the workload on the heart, which is especially important for older adults who may already struggle with heart disease, arrhythmia, or reduced cardiac output. Many seniors live with conditions like peripheral artery disease or chronic venous insufficiency, issues that often go unnoticed until a crisis occurs. By lifting your legs, you lessen these underlying burdens at a moment when the heart and brain cannot afford additional stress. There is a powerful emotional element to this step as well. Elevating the legs creates a subtle feeling of relief, a sense that your body is finally being supported rather than pulled downward. Many seniors describe it as the moment when their breathing begins to settle or their fear becomes more manageable. In a crisis where confusion and panic can cloud judgment, this small sense of control is invaluable. It reassures you that you are not helpless, that your body still has the ability to respond, to protect itself, to survive until trained professionals arrive. This position also prepares your body for clearer thinking. As blood flow to the brain becomes more stable, many seniors notice that they feel less overwhelmed and more aware of their surroundings. You may not feel normal, but you may feel grounded enough to recognize symptoms, speak to someone nearby, or prepare to call 911 if you have not already done so. These moments of clarity can be life-saving because they allow you to communicate what is happening, and that information guides emergency responders toward faster, more accurate treatment. But elevating your legs is not the final step in protecting your brain during those crucial minutes. There is one more action that works hand in hand with circulation, one that directly influences blood pressure, oxygen levels, and the body's stress response. It is something you can control entirely on your own, even when your muscles weaken or your speech slips. And its impact on the aging brain is profound. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now, let's keep going with point number 4. 4, breathe slowly and purposefully, 426 pattern. The moment your legs are elevated and your body settles into a safer position, something else begins to matter just as urgently, your breath. For many seniors, breathing is so automatic, so quiet, they rarely think about it until the moment. A medical crisis steals that sense of calm. During the early stages of a stroke, your breath becomes more than a routine function of the lungs. It becomes a stabilizing force, one of the last tools you have to protect your brain while waiting for help. And the way you breathe can either fuel panic or maintain the flow of oxygen your aging brain is fighting to hold on to. For older adults, the body's response to sudden fear is often sharper and more intense than expected. When you feel your face weaken or your words turn into something you cannot control, a wave of alarm rises quickly. The heart begins to race. The breath becomes shallow. Muscles tighten as if preparing for danger. But in a stroke, this instinctive reaction does not help. It actually makes things worse. Fast breathing lowers the level of carbon dioxide too quickly, causing blood vessels in the brain to narrow. When vessels tighten, less blood reaches the areas already struggling. Seniors who panic often describe a rising sense of fogginess, a feeling of drifting away, or a sudden confusion that deepens with each rushed breath. What they do not realize is that their breathing has turned into an enemy. This is why purposeful breathing, the 4 to 2 to 6 pattern, becomes so powerful in these moments. By inhaling through your nose for 4 seconds, holding that breath for 2, and then releasing it slowly for 6, you help restore balance to your nervous system. The long exhale signals your brain to relax the tightness in your blood vessels, allowing a steadier flow of blood to reach the areas that need it most. For seniors whose vessels may already be narrowed by age, this gentle widening can make a meaningful difference in preserving brain function. And there is something deeply human about this kind of breath. It creates a moment of control in a situation that feels uncontrollable. It grounds you when the world inside your own body feels unfamiliar. Many older adults have lived through wars, loss, hardship, illnesses, and decades of challenges. But in the quiet seconds of a suspected stroke, strength looks different. It is not about standing up, pushing through, or enduring silently. Strength becomes the ability to slow down, to breathe with intention, and to give your body the oxygen it needs to keep fighting. Medically, slow breathing also helps regulate blood pressure, a critical factor during a stroke. High blood pressure can worsen bleeding strokes, while a sudden drop in pressure can starve the brain even more during an ischemic stroke. Purposeful breathing steadies both extremes, helping your heart work more efficiently without forcing it into overdrive. For seniors with heart disease, arrhythmias, or chronic lung conditions, this stabilization is even more vital. It gives the heart a measured rhythm, allowing oxygen to flow without the strain or chaos that panic brings. Emotionally, slow breathing creates a sense of peace when fear threatens to take over. Many seniors describe early stroke symptoms as deeply unsettling, a loss of control in the very parts of the body they have relied on their entire lives. But when you breathe slowly, you create a brief but powerful reminder that you are still present, still capable, still connected to yourself. This emotional steadiness helps you stay alert enough to call for help, answer questions from emergency responders, or communicate your symptoms to the people around you. Breathing with purpose becomes both a medical tool and an emotional anchor. It helps protect the brain, preserve clarity, and give your body the best possible chance until professionals take over. But while breath offers calm, there is another crucial step that requires clarity and awareness, one that determines the kind of treatment you may receive and shapes your chances of recovery. 5. Note the exact time the symptoms started. In the middle of a frightening moment, your arm turning weak, your words slipping out in fragments, your vision dimming at the edges, it may feel strange to think about the clock. But for older adults, remembering the exact time these symptoms began is one of the most powerful actions you can take to protect your brain. It is not a small detail. It is the information that guides doctors toward the right treatment, the right medications, and the right interventions that may save your independence, your speech, and your quality of life. As we age, the brain becomes more sensitive to changes in blood flow. A younger brain may withstand several minutes of reduced circulation with less permanent injury, but an older brain is more vulnerable. The cells that manage memory, speech, and movement can begin to weaken within minutes, and the damage can deepen quickly if blood does not return. That is why emergency physicians call stroke treatment a race against the clock. Every passing minute represents millions of brain cells struggling for oxygen. Certain life-saving medications like clot-dissolving drugs must be given within a very narrow window. For some people, it is 4.5 hours. For others, depending on age, blood pressure, or medical history, it may be even shorter. If doctors do not know when your symptoms started, they cannot safely give these treatments, even if they might help you. The risk would be too high. This is why noting the time matters so deeply. It is your way of giving doctors the information they need to protect what is most precious to you. Your ability to speak to your family, to walk on your own, to remember the people you love. In a moment when everything feels uncertain, the simple act of glancing at a clock or saying the time out loud is an act of strength and awareness. If you are alone, speak it clearly. It started at 3:12. Saying it helps you remember it. If someone is with you, tell them the moment symptoms began. Their memory may be sharper than yours under stress, and they can relay the information to emergency personnel with confidence. For seniors, time awareness is especially important because stroke symptoms are not always dramatic at first. Some people experience only a brief tingle in the hand, a slight droop in the face, or a wave of confusion that passes quickly. Many dismiss it, thinking it was nothing more than fatigue or low blood sugar. But those subtle signs may be the beginning of something far more serious. And if symptoms return or worsen to the point where you need emergency care, the doctors will need to know exactly when the first change occurred. That initial moment, however small it may have seemed, is the true start of the clock. There is also an emotional truth that older adults understand more deeply than anyone. Clarity fades under fear. When the body shakes, when speech slips, when breathing becomes a task, memory becomes fragile. That is why stating the time out loud, repeating it, or asking someone to write it down is more than a helpful reminder. It is protection against the confusion that can accompany a stroke. It locks in the information before adrenaline blurs the moment. And there is another reason time matters. Knowing it gives you a sense of control. A stroke can make seniors feel powerless, as though something invisible has taken hold of their body. But identifying the moment it began gives you an anchor, a reference point, a sense that you are still participating in your own rescue. You are not waiting helplessly. You are actively helping your future medical team fight for you. For older adults who live alone, This awareness becomes even more crucial. If symptoms start suddenly and you are by yourself, the clock becomes your companion. Speak the time aloud. Look at your phone. Whisper it if necessary. It may feel strange, but paramedics often repeat patients' own words to the hospital team, using that timestamp to guide rapid decisions that influence long-term recovery. And once the time is noted and your breath is steadied, there is a final layer of protection, an action that requires both courage and acceptance, one that ensures help is truly on the way. 6. Stay completely still until help arrives. After noting the exact time your symptoms began, the next instinct many older adults feel is the urge to power through, to push themselves upright, to test their strength, or to move toward the front door to meet paramedics. But during a suspected stroke, movement is not a sign of bravery. It is a risk, one that can turn a recoverable emergency into a life-altering crisis. When blood flow to the brain becomes unstable, even small movements can disrupt the delicate balance your body is trying to maintain. That is why the next critical step for seniors is deceptively simple yet profoundly important. Stay completely still until help arrives. Remaining still protects you in ways you may not immediately see or feel. When the brain is starved of oxygen, even briefly, it loses its ability to coordinate the body. Muscles weaken without warning. Balance becomes unpredictable. Vision may blur. A step that once felt steady can suddenly collapse beneath you. For older adults whose bones may be more fragile and whose reflexes may have slowed over time, a fall during these early minutes can lead to broken hips, spinal injuries, or head trauma. Injuries that can permanently rob a senior of mobility, independence, or even the chance of recovery. By staying still, you are not being passive. You are preventing additional harm, giving your brain the quiet and stability it needs while waiting for trained professionals to take over. There's also a deeper biological reason stillness matters so much. When you move, especially when you strain, twist, or try to get up, your heart must work harder to supply blood to your muscles. This increased demand can worsen the shortage of oxygen available to the brain during a stroke. Older hearts, particularly those with a history of high blood pressure, heart disease, atrial fibrillation, or long-standing diabetes, may not be able to handle this sudden shift. Staying still keeps your heart rate calmer, your blood pressure more stable, and your circulation focused on the one organ that needs it most in that moment, your brain. Emotionally, stillness is an anchor. A stroke can feel like the ground is shifting beneath you. Your thoughts may feel distant, words may slip out of reach, and your own body may feel unfamiliar. The fear of losing control can tempt you to move, to fight, to do something, anything to regain a sense of normalcy. But for seniors, especially those who have spent a lifetime taking care of others, the hardest act is sometimes the most necessary one. Allowing yourself to simply stay where you are and let others come to you. Stillness becomes a form of courage, a declaration that you trust your body enough to protect it, rather than push it beyond its limits. For older adults living alone, this step may feel especially challenging. Many seniors worry about being a burden, or they fear that staying still will slow down help. But in truth, once 911 has been called, staying still is the safest thing you can do. Paramedics are trained to find you, assess you, and support you where you are. They would rather reach you lying safely on the floor, breathing steadily, legs elevated, than find you collapsed halfway to the door, injured from an unnecessary fall. Stillness ensures that the emergency team can begin immediate care without added complications. It is also important to remember that the symptoms of a stroke can change quickly. Weakness in the arm may spread to the leg. A mild slur in speech may suddenly worsen. Dizziness may deepen into confusion. Movement can accelerate these shifts by increasing the brain's oxygen demand at a time when the supply is already limited. Remaining still helps stabilize your condition long enough for professionals to intervene, yet staying still does not mean staying silent. There is one more step, perhaps the most decisive of all, that connects you with life-saving treatment. It is the moment when stillness meets action, when courage becomes communication, and when your path to recovery truly begins. 7. Call emergency services or instruct someone to call immediately after you have remained completely still, protecting your body and conserving your strength. The most decisive action you can take is to call for emergency medical help immediately. For seniors, this step is not only practical, it is life-preserving. A stroke is a race against time, and no amount of courage, endurance, or past experience can replace the specialized care that trained emergency responders provide. In these moments, calling 911 is not a sign of weakness. It is a declaration that your life, your independence, and your future matter. Many older adults hesitate to call for help, especially if they live alone or fear bothering someone. This hesitation is deeply human. You may worry that the symptoms will pass, that you are overreacting, or that you might arrive at the hospital only to learn it was nothing serious. But strokes often begin with subtle signs: a momentary slur, a passing numbness, a sudden fogginess that vanishes as quickly as it appears. These brief warnings can mislead even the strongest, most aware seniors into believing the danger has passed. In reality, they are often the first tremors before a larger event, and waiting just to see is the most dangerous choice of all. Calling emergency services triggers a chain of care designed specifically for stroke. Paramedics can assess your symptoms, monitor your vital signs, begin supportive treatment, and alert the hospital before you arrive so that a team is ready and waiting. This advance warning can shave precious minutes off the diagnostic process, increasing the chance that you will receive time-sensitive treatments such as clot-busting medications or procedures that remove blockages from the brain's major arteries. These treatments are most effective when started early, and the difference between receiving them at 40 minutes versus 90 can mean the difference between full recovery and permanent disability. For seniors, especially those with heart disease, diabetes, high blood pressure, or prior strokes, calling for help promptly becomes even more essential. Your body has already carried years of strain, and your brain may not tolerate additional delays. When you call 911, you are giving yourself access to the tools, expertise, and speed that modern medicine offers. You are giving your brain a chance to survive. If speaking is difficult, as it often is during a stroke, use whatever sounds, words, or gestures you can. Paramedics are trained to understand slurred speech, broken sentences, or incomplete responses. If you have a medical alert system, activate it without hesitation. If someone is with you, tell them clearly and firmly to make the call. Do not let them wait. Do not let them second guess us. These early moments require leadership from you. Even in your vulnerability, your insistence can save your life. Calling for help also offers an emotional shift, one that brings comfort to many older adults. When the sirens approach or when the dispatcher begins guiding you through questions, you are no longer alone in the moment. Fear becomes shared, responsibility becomes shared, and the weight you have been carrying physically and emotionally begins to lighten. Knowing that trained hands are on the way can calm the heart, ease the breath, and steady the mind, all of which protect your brain as you wait. Some seniors worry about the cost of an ambulance or the embarrassment of a false alarm, but no bill, no awkward moment, no worry about judgment is worth your life. Paramedics would much rather arrive to find you safe than arrive too late. You deserve to be cared for. You deserve to be protected. You deserve the chance that calling for help provides. And once the call is made, once the wheels are in motion and help is on the way, you have completed the final step in this chain of life-saving actions. But while these 7 steps guide you through the first critical moments, their true power lies in how they connect, how they prepare your body, your mind, and your future. Because the story does not end here. There is a deeper message, a lesson every senior should carry long after the emergency has passed. The power of preparedness, your strength in the first 3 minutes, in the quiet moments before help arrives, when your body begins sending signals that something is terribly wrong, you hold more power than you may realize. These 7 actions, sitting safely, lying flat, elevating your legs, breathing with intention, noting the time, staying completely still, and calling for emergency services are not complicated medical procedures. They are simple human steps rooted in wisdom, clarity, and self-protection. And for older adults in America, they represent the bridge between fear and survival, between uncertainty and hope. A stroke does not announce itself politely. It arrives suddenly, disrupting the body you have lived in for decades. But even in that moment of vulnerability, you are not helpless. The body speaks in signals: weakness, dizziness, slurred words. And when you respond quickly, you slow the damage, protect your brain, and give medical professionals the chance to intervene at the right moment. Every senior deserves to know that their first response can shape the entire path ahead, how well they recover, how much independence they keep, and how confidently they continue living their life. Preparedness is not about living in fear. It is about living with awareness. It is about recognizing that your life experience, your resilience, and your ability to act with calm purpose are as valuable as any medication in those early minutes. You are not at the mercy of the moment. You are an active participant in your own protection. And that truth carries strength. It carries dignity. It carries hope. Share this knowledge with the people you trust, your family, your friends, the neighbors who check in on you, and the caregivers who walk this journey beside you. Because strokes do not only affect the person who experiences them, they ripple through every part of a family, every corner of a community. When more seniors know what to do, more lives are spared from disability, more memories are preserved, and more years are lived with clarity and purpose. Your body is wise. It warns you. It signals you. And when the moment comes, the steps you take in those first 3 minutes can become the reason you rise again, speak again, remember again. And now that you carry this knowledge, the next question becomes just as important. How can you prepare your daily life so a stroke is less likely to happen in the first place? These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.